Did you know that for decades, women have been misled and misinformed when it comes to menopause? The Women's Health Initiative study changed everything, but not in the way you think and not for the better. If you've ever felt like your concerns about menopause were dismissed, then you're not alone. Let's talk about how the system got it wrong and what you can do about it. Today, I want to share with you the story of how doctors have failed women in menopause, all because of the Women's Health Initiative study. This isn't just history, it's your story and one you must know about. I'll also tell you about several things that were done wrong during the study. The Women's Health Initiative, or WHI, was one of the largest studies ever conducted on women's health. It started in 1991 with over 160,000 postmenopausal women participating. The goal of the study was to find out if hormone replacement therapy improved nutrition and calcium vitamin D supplements could help prevent heart disease, breast and colon cancer, and osteoporosis in postmenopausal women. So this was a big deal. However, instead of empowering women, the results of this study created confusion, fear, and suffering. Here's what happened. In 2002, the researchers from the WHI study released a bombshell finding. They stated that HRT was linked to an increased risk of breast cancer and heart disease, and the media ran with it. Headlines screamed about the dangers of HRT, and doctors across the country stopped prescribing it almost overnight. Women who had been relying on HRT to manage their symptoms were left in the dark. Many were told to stop taking it immediately. Doctors were worried about lawsuits and stopped prescribing HRT. Within 1 year, prescriptions for HRT dropped by 50%. But here's the problem. The WHI study was deeply flawed. Most of the women in the study were in their 60s, long past menopause. The average woman hadn't started HRT within 10 years of attaining menopause, so age and length of time in menopause were unfavorable. Also, very few of the women had menopausal symptoms. Recent studies show that hormone therapy works better when a woman is in perimenopause and postmenopause and still experiencing symptoms. The benefits of HT appear to continue for as long as she has symptoms, but not for long after. This means there is a menopausal window when hormone therapy can improve cellular health in your body. If given late, estrogen may no longer have the capability to protect, but may even possibly have adverse effects. So hormone therapy could benefit a woman in her 50s, but have no impact or even harm a woman in her 70s. Some of the women in their late 60s and 70s may have already developed some of the medical conditions the study was aiming to observe, such as blood clots, heart disease, and increased risk for breast cancer. Another limitation of the WHI study was that different estrogen preparations from what we currently have were used. The type of estrogen used in the WHI trial is called conjugated equine estrogen, CEE. These are made from female horse urine and contain more than 10 different types of estrogens with only small amounts of estradiol. Today, estradiol is available on its own as a bioidentical estrogen, which is now more commonly used. During the WHI study, CEEs, conjugated equine estrogen, were given in high doses by mouth. Oral estrogens are metabolized in the liver, meaning it can create additional complications. Current researchers believe oral CEEs might have distorted the WHI studies, as some studies have found that oral estradiol, commonly used today, may be safer than oral CEEs used in the WHI study several years ago. The type of progesterone used in the WHI study also likely muddied the waters. Medroxyprogesterone acetate, MPA, a type of progestin, was used in the WHI study. It is thought that MPA may have played a role in the higher risk of breast cancer several years ago. Newer hormone therapy usually contains bioidentical progesterone, which is a safer alternative. So the summary of the recent revisit of the WHI study is that the wrong drugs were tested on the wrong population. In a sense, the WHI study was like being given a map that's supposed to guide you on a journey, but instead points you in the wrong direction. Doctors relied on flawed information and women paid the price, sadly. But what did this actually mean for women like you? Without HRT, millions were left to battle menopausal symptoms on their own. You likely know the struggle all too well. Maybe you've been told to just push through when you couldn't sleep for weeks, or perhaps you've been given antidepressants when what you really needed was hormonal therapy. I've heard stories from some of my patients who felt like they were losing themselves, unable to focus at work, snapping at their loved ones, or feeling disconnected from their own bodies. And here's the heartbreaking part. The proper treatment could have prevented or managed many of those symptoms. In fact, a survey by the Menopause Society found that 72% of women felt unprepared for menopause, and most said their healthcare providers didn't give them the support they needed. That's a huge gap in women's healthcare. So where does this leave us today? Thankfully, research has come a long way since 2002. We now know that HRT, when started within 10 years of menopause, can actually lower the risk of heart disease and improve overall quality of life. It can also protect bones, reduce the risk of diabetes, and even help with brain health. The hormone therapy position statement by the Menopause Society highlights the importance of individualized care and regular follow-up with your healthcare provider. You deserve a healthcare provider who listens, who treats you as an individual, and who understands that menopause isn't something you just get through. It's a pivotal time, and you can thrive if adequately managed. Check out this next video for more tips to improve your health in menopause.